Hey guys, welcome back. It's Nurse Karma here, and today I wanted to talk to you guys about how to give a good change of shift report so that you guys could go ahead and impress everybody on the unit. Alright guys, so the first thing you're going to notice when you're on the unit is that everybody gives report differently. You're going to notice that some people are very elaborate, very detailed, and they give a really good report. And then there's some nurses that are just all over the place. They start telling you, oh, the patient came from here, and then this happened, and that, and blah, blah. And then they jump around, giving you a report on different body systems, and it just doesn't make sense. So you're really going to find out whether you received a good report or not when you complete your shift assessment and you read the physician progress notes. Because in there, you'll be able to check off, well, that was a lie, that was true, that was a lie, and you'll learn who you can trust on the unit when you're receiving a report. But anyways, I wanted to talk to you guys about how you can go ahead and give an awesome report that's going to impress everybody on the unit. Alright guys, so the first thing you're going to do is you're going to tell this oncoming nurse why is the patient here. You have to remember that this is their first time meeting this patient, so they have no clue what's going on. And by why the patient's here, I don't just mean the admitting diagnosis. If the admitting diagnosis is respiratory failure, you have to tell them, oh, the patient was found unconscious, paramedics brought the patient into the hospital, they had to intubate the patient, then the patient was in ICU, he was brought over to the floor. You need to be that type of detailed so that they can know why the patient is here and how critical the patient currently is. Alright guys, so the second thing you want to do is you want to make sure that you give a thorough medical history. Okay, you want to talk about, does the patient have diabetes, COPD, any allergies, anything that could possibly make things worse that this nurse needs to be on the lookout for. You know, things like that is what you have to discuss. Okay, so the next step is going to be a thorough review of all the body systems, and this is going to be your shining moment. Ah! So you're going to go ahead and tell them, okay, so the patient's here for respiratory failure, and when I auscultated the lungs, I listened to a little bit of crackles in the lower bases and some wheezing in the upper bases. So this patient currently is getting respiratory treatments every 6 hours, and we're giving 40 milligrams of Lasix IV as well to treat that. So this is how you guys are going to go ahead and be detailed about your report and show that you actually know what you're talking about. Alright guys, so the last step is we want to talk about what is the current plan of care. Why is this patient still here? So this is the time when you go ahead and inform them, oh, we're pending a consult for the pulmonologist. And a part of giving a good report is that you go ahead and tell them these things so that when they do receive that call, that nurse isn't completely up in the air. Oh my God, I didn't even know this consult was pending. What is it pending for? You know, we want to go ahead and tell them about any abnormal lab values, anything that's pending for them to collect. We need a urine sample, a sputum culture sample. And this is part of our report so that we can go ahead and make sure that this patient gets better and they're able to be discharged safely. Alright guys, so I hope you guys found this video super helpful, and with these tips you guys are going to be pros at giving a report. Everybody on the unit is going to respect you and they're going to be like, wow, that new grad surely has her thing going on. She knows exactly what's going on with these patients and I trust her when she gives me a report. So I just want you guys to know that I love you, and go ahead and make sure to subscribe, hit the like button, and make sure to follow me on Instagram at NurseKarma24. I'll be posting up pictures with my dog and things that I do and little nursing things so you guys can laugh about later on. So, with all my hippie love, signing out.